At the advent of the dreaded coronavirus, there was an uproar around the world that made compulsory the continent to put in place measures to combat this novel pandemic that has brought the world to our knees. Though advanced countries like the United States and the UK recorded rates of cases and deaths, Nigeria recorded 67,220 cases as at now and 1,171 deaths among its nearly 200 million citizens. Among the 36 states in Nigeria, the Sunshine States, also known as OndoState, with a very effective government under the governorship of Arakunrin Olarotimi Akeredolu, SAN, battled the pandemic since inception till date and in readiness to handle a next phase if it eventually ensues. This battle strategized and managed by an inter-ministerial committee set up by the state government with an effective system. This system led to provision of medical consumables like PPEs, personal protective equipment, which include face masks, hand gloves, overall body covers, sanitizers, etc. Procurement of ventilators, hospital beds, ICU beds to augment the already existing ones and lab equipment, recruitment and stipends, call centers for swift response to cases, molecular laboratories for sample testing, which enabled the government to have easier access to curtailing this disease. Samples were no longer taken to Ede for testing. Government created 3 testing labs and still providing more. Ambulances and e-loxes for mobility of response team. Ondo State recorded our first case on the 3rd of April 2020, according to Dr. Gboyega Adekunle Famokun, the state epidemiologist affiliated with the Nigeria Center for Disease Control, NCDC.
The first case in Ondo State was reported on April 3rd, 2020, this year. But immediately we reported the first case in Ondo State, I have to move in, and we activated our rapid response team. Of course, before then, active surveillance has been in place, looking for cases of COVID-19. We'll be collecting samples before we recorded that first case.
During this period, test samples of victims were taken to Ede in Osun State for testing, but the governor of Ondo State has ensured that testing is possible in Ondo State. 4 months after the government has eased lockdown restrictions, people are able to move freely. It was well handled that some people find it hard to believe that the coronavirus ever existed in Ondo State. However, inside the hospital, where less than 5 survivors of COVID-19 are recuperating, the story is different. So why are you here?
I was tested. I ran a test on COVID-19. I was positive. That's why I'm here for treatment.
I came to do a COVID test. I found out that it was positive.
So how did you feel about that result when you were told?
Well, it was somehow to me, because I never dreamed I can be positive of such. But when it's come, I have to take it.
So how has been the treatment so far?
The treatment has been very good, effective. And the nurses are fantastic. The workers are fantastic.
So what do you have to tell people out there who don't believe there's COVID-19?
Wow. COVID is real.
It's real.
Very, very real.
It's real, it's deadly. You can still see my tongue, eh? Black.
It's real and it's deadly. My advice is people should try and run a test.
The reaction of the state government was swift under the governance of Arakunrin Olarotimi Akeredolu, SAN. With the 70-bed isolation ward at the University of Medical Science in Ondo State, the visibly empty halls showed that the swift response of the government paid off. The government was able to curtail the over 1,728 cases recorded in the state since the first case. Dr. Ajibayo Adeyeye, the Acting Commissioner of Health of Ondo State, restated the government's effort in managing the virus.
The state government took the bull by the horn, knowing the infectivity rate of the coronavirus disease and the way it has been said that it is highly effective and it spreads so much. We took the bull by the horn. The governor created the COVID-19 Interministerial Committee comprising of members from the Ministry of Health, members from the Ministry of Environment, Ministry of Agric, Information, and Dr. Wahab Adegbenro, the former Commissioner for Health, was made the chairman of that Interministerial Committee. May his soul rest in peace. He did his best. And we started work. I was a member of that committee too. We mapped out strategies to ensure that we curtail the spread of the coronavirus disease at that time. The isolation center in Akure was established and refortified, and we also established another isolation center in Ikare. Even the TB ward at the IDH was converted to isolation center, in which case we had almost 50 to 60 beds of isolation ward in Akure and another 80 beds in Ikare. We also started building the isolation ward in Okechikupa, which has now been completed and is ready for occupation. Then we took a policy of testing everybody that we were led to test. That is, if people have symptoms that look like COVID-19 or they have ailments that look like COVID-19, we tested them. And if they are positive, the policy of the state at that time was to isolate everybody that was positive for COVID-19. During the COVID-19, when the matter was, when we were still practicing the policy of isolating people, there was also a time when the state was locked down. During the lockdown, we realized that people could not go to their businesses as expected. They could not make daily income as expected. So government came to the rescue by providing various types of palliatives, give out bags of rice, give out food packs, give out all sorts of palliative to ensure that the citizens can stay indoors and obey whatever protocol we had in place then before we relaxed the protocol and allowed people to go to their markets. Not only that, we even bought cars, bought some vehicles for surveillance activities. Up till now, as I speak to you, COVID-19 test is still free in Ondo State. Government bears the responsibility. We do the test and you get your result within 24-48 hours. And government is trying its best to ensure that we curtail the spread of COVID-19. We only need our people to complement all government efforts by obeying the protocols, the dictates of the committee that we should wear masks, should keep safe distance from one another, should wash our hands so many times in one day, and so many other measures that have been put in place.
The state government will be ready for second phase of the lockdown if it eventually hits Ondo State. The medical director of the Federal Medical Center, OWO, also buttressed the state government's support during this pandemic.
Apart from the training, federal government also released money for 3 months for all the health workers, everybody working in the hospital. Those that are directly involved, 50% of their salary, and those that are not directly involved, like those like me, they were paid 10% for 3 months. So they paid that. And some other people directly involved. And when the people go for training too, there are allowances, DTAs and all that they collect. And with the knowledge that they gain, it's a lot. And, with international recognition, some of our staff now, they are now trainers under NCDC. When NCDC wants to do anything, they will call them to train them. I want you to also visit the auditorium and see how training is going on. Some of our doctors, 5 of them, just returned from Abuja for a training on IPC and some investigations. They are now stepping down the training. So these are some of the things that we get from treating infectious
The now
diseases.
empty Infectious Disease Hospital, IDH, was formerly overrun with victims of the virus. Lots of challenges were faced by these health workers, but the government's readiness to battle the novel pandemic prevailed. The figure of the coronavirus cases in Nigeria was stabilized around July, when many countries were still battling to survive.
Coming from a period when the state recorded an alarming 100 cases and 18 deaths in less than 8 days, the fear of the second wave of the virus is also reinforced by many state governments who might have eased the enforcement of safety rules. The government tackled the novel virus by implementing a committee which oversaw the coordination of COVID-related activities in the state. At the Disease Surveillance and Notification Center, more vans were provided by the government to allow easy mobility of the pandemic workers. Dr. Gboyega Adekunle restated the government's readiness to tackle any infectious diseases which might resurface.
A lot of measures have been put in place that helped Ondo State at least to curtail the spread of COVID-19. You bear me witness. Borders were shut down, everything like that. That's why you see the number of deaths in Ondo State is not so alarming compared with the number of cases and deaths in some other states.
Apart from crippling the economy and making most people's livelihoods stagnant, the government of Arakunrin Olarotimi Akeredolu appointed a Coronavirus Response Fund Committee. This committee managed the input of donors ranging from individuals, private and public organizations, alongside foreign agencies, which is used in complementing the efforts of the state government on the current war being waged against the spread of the virus in the state.
The mere fact that some may have not seen affected individuals or bodies of deceased victims doesn't mean that the virus isn't still hovering around our world.
According to experts, there is a second wave coming, and government readiness cannot be overemphasized.
I'm Dr. Stephen Fagbemi. I'm the State Epidemiologist for Ondo State, Ministry of Health, and I'm also the Incident Manager for Ondo State Emergency Operating Center for COVID-19. Well, when the COVID-19 started, it took everybody by surprise. I mean, this thing started just last year, December. The rate at which it was spreading, the information we were getting from Europe and America on the international cable stations were scary. So yeah, personally, I was a bit afraid, despite the fact that by training I'm a community physician. You think you know something, but there was nothing like this. We didn't read about something like this in the books, and people were getting infected, so we were afraid. But partly training, partly conviction, resolve, and responsibility kicked in. We knew that if we didn't stand to fight this, it's going to overrun our communities, and it's just as the soldiers have to fight insurgents. This is why we're trained. This is why the country trained us. We have to draw the line. And the National Center for Disease Control, under the leadership of Dr. Shikwe Ekwazo, had also tried over the past few years, since Ebola, to prepare us for something like this. And so all that training, all that support kicked in. And we were able to say, look, we just needed to do something. And if the health sector must respond, those of us in the public health domain, those of us who have this kind of background, we have to be at the forefront. So, and again, Ondo State have been having Lassa fever for a couple of years. So that helped, and we just had to. And once we started doing what we had to do, watching what was happening in Lagos and Abuja, they were getting it right. We just keyed in, and yeah, we did it. Yeah, you still think that you may be infected. A lot of health workers were also scared. The patients were being turned back initially, but we rallied ourselves. Government tried to encourage, motivated, a little palliative incentives here and there, and the initial scare because of PPE. The health workers were afraid initially because there weren't enough PPE anywhere in the world, so Nigeria was not an exception. But once those things came and they felt protected, and we now begin to have a hang of what this disease is about, it turned the tide.
Testimonies of survivors cannot be ignored as they complement the contributions and efforts of the state government towards their quick recovery during this sad period.
I'm Timlane by name. I'm a COVID-19 survivor.
My name is Ikoyo Ezekiel. COVID-19 is so real. But one thing about it is the fact it's not a death sentence. Of course, one or two persons among myself are actually survivors. So that means that a lot of persons can actually go through that stuff if they actually come out to make themselves known, actually get out of it. So the best thing I would tell people that actually is to not to think that it is not real, or maybe government actually trying to fake it to get certain stuff and all that and all that. It's so real. If for the avoid for to get, not to get contracted, I think what you do is to just obey all the safety rules related to COVID-19. But if for any reason you begin to feel, some inconvenience, you don't have to keep it to yourself. You have to report very quickly to the COVID-19 response team so that you get tested and then you know your status. It's not a death sentence. A lot of people are coming out of it, and they are coming out so strong.
I will just advise people that if once they get their result being positive, they should go for the treatment. It's very advantageous than being at home, quiet with yourself, So it can result to another thing which you don't plan for.
Once again, my name is Boyega Adekunle Famuku, OndoState Disease Surveillance and Notification Officer, and also a field epidemiologist with Nigeria Center for Disease Control. Based on my experience, based on what I have seen, based on the data available to us at this level, both at state and national, COVID-19 is real. COVID-19 is with us. I want to advise people outside that we should try, by all possible means, to make Ondo State COVID-19 free. We can achieve it. We can do it. Let's keep pushing.
I am Dr. Jibayo Adeyeye. I'm the Special Advisor on Health and the Acting Commissioner for Health in Ondo State. COVID-19 is real. Let us make Ondo State COVID-19 free.
My name is Shola Ajishafe. I'm a lawyer. I was attacked by COVID-19. I beat COVID-19. You too, you can beat COVID-19. Let us join hands to make Ondo State COVID-19 free.
My name is Stephen Fagbemi. I'm a community physician, and I'm the state epidemiologist of Ondo State. I'm the incident manager for Ondo State COVID-19 EOC. COVID-19 is real. The virus is still out there. Please stay safe. Let's make Ondo State safe for everybody. Thank you.
Please let us make Ondo State COVID-19 free. In fact, not only Ondo State, Nigeria generally, and of course the world all over.
There are already measures put in place to curtail the spread. So let's make Ondo State COVID-19 free by ensuring that we take all preventive measures as seriously as possible.